Hello there, and welcome to Level Up Your Skill Set 4 Ways Infant Massage Supports Your Therapy Goals. I'm Laura Barnard, and I'm thrilled to have you here with us today. Okay, so before we dive in, let's make sure that you are settled in with your favorite pen, notepad, and snuggled in on that cozy spot on the couch. I've got my green highlighter and peach Celsius by my side. Now, after the webinar, if you still have questions, please reach out to me using the email admin@pediatrictheraptools.com. I promise to get back to you as soon as I can. But right now, I am so excited to share with you how infant massage can enhance your pediatric therapy goals. You signed up to watch because you want to learn evidence-based techniques to promote neurosensory and sensory motor development in both infants and children. Plus, I really want you to stay until the end to hear about a few exciting bonuses. And hang on tight because for the next 30 minutes or so, it's going to be a lightning round of information. Okay, so let's start off with a few things about myself. When I graduated occupational therapy school back in 2002, I was part of a pediatric outpatient clinic tucked in the foothills of North Carolina. It was just me, one physical therapist, and one speech therapist. And to be honest with you all, we were all new grads and just out there trying to figure it all out. Now, luckily, I had just finished an intensive peds rotation outside of Phoenix, Arizona, where I had my clinical instructors to lean on. But now that I was a fully licensed OT, it was a bit overwhelming to say the least. I truly remember feeling like I was running in circles and getting beat up by little kids all day long. Not fun, right? And unfortunately, that is exactly what can lead to burnout real quick. Then in 2004, needing continuing education credits for my license renewal, I took a certified infant massage class. The course was wonderful, obviously, since I still use the technique, but it was not taught by a healthcare provider. Someone who could answer the question, this all sounds great, but what does this actually, quote, look like back in the clinical setting? So the result of that, a lot of me troubleshooting on how to implement various massage strokes for various ages and diagnoses, how to document, how to write goals, and can I even bill for service? Then in 2020, I was determined to have something good come out of that year, and I became a board certified neonatal therapist. Then in 2021, I created Pediatric Therapy Tools. I wanted to create a continuing education company for therapists by therapists. Therapists who are still in the clinical setting and can relate to the trials and tribulations of therapists and other pediatric healthcare providers in the patient care workforce. Because let's face it, burnout is real. The overwhelm is real. The desperate search for motivation is real. I've had countless OT students during my years of practice and my colleagues urging me to teach to the masses. So here I am, and I am pumped that you are too. Okay, so let me ask you a question. Do you believe infant massage is just for infants? Okay, probably so. When I was first certified in 2004, I was mainly treating toddlers. I wasn't sure if I could use infant massage, but slowly over time and through a lot of trial and error, I discovered, oh my gosh, you know what? Infant massage isn't just for infants. This technique can literally be used on every patient that comes onto my caseload. It doesn't have to fit the, quote, mold of what we envision an infant massage session to be. And I can write functional goals using infant massage. And if I can write functional goals, then I can bill for service. And it was kind of my drop the mic moment, if you will. Implementing infant massage, and by the way, I kind of get irritated by the name. Yes, the name of it is, quote, infant massage, right? But again, it goes way, way beyond infancy. Okay, so let's see something. Answer these questions for me. Do you ever go and get a massage? Or have you ever had your loved one massage like your neck or your shoulders or even your feet? Most likely, yes. So see, so many of us as adults still go and get massages. It was that aha moment that massage isn't just for infancy and then skip all the way to adulthood. It spans the lifetime. Okay, so now let's take it a step further. Okay, think about what are the reasons that you go and get a massage. Okay, decrease stress, promote sleep, right? Exactly. So according to the American Massage Therapy Association, 42% of massage consumers get them for health and wellness reasons, and 67% of people surveyed in 2018 said their primary reason was medical or stress related. Among these reasons include to reduce pain, improve sleep, and decrease muscle tightness. Any of these sound familiar? Well, of course they do. Okay, so now that we've paused and acknowledged why we as adults go and get a massage, let's move into the 4 ways infant massage can support your pediatric therapy goals. We are going to bring everything full circle, and I want you to think of this as a microwave versus slow cooker style of learning, okay? So we're going to go pretty fast. Okay, so number 1, bonding and attachment. Historically, infant massage was done to promote bonding and attachment. However, for our parents with special needs children, this can be challenging. These parents are experiencing a wide range of emotions, making it especially difficult to bond with their child. These emotions, often linked to grieving and trauma, can hinder parents from fully bonding with their child. An article from the National Institute for Health in 2021 reports that up to 50% of mothers who have a child with special needs can experience depression. Okay. So how does teaching infant massage help with bonding and attachment? Well, it's a common myth and misconception that infant massage is only good for the receiver, but research has proven that massage is also good for the giver. So what happens is during an infant massage routine, and when I say routine, this could be anywhere between 5 to 50 minutes, okay? Both the parent and the child will build a connection, learn communication through body language, and boost the parent's confidence with handling their child. Both the parent, and when I say that, I mean moms and dads, okay, and the child will release endorphins, which is, of course, our feel-good hormone. The mother will get the added bonus of her prolactin and oxytocin releasing, okay, which will help in milk production and the letdown reflex. Yeah. So 2 big bonus benefits that directly affect you as the pediatric therapy provider. Okay, so let's look at those. Number 1, you two will build a quicker bond and rapport with your little ones, as well as, number 2, have increased confidence with your clinical handling, such as with stretches and positioning. Carmen An occupational therapist in the Czech Republic said, "I am loving infant massage. I think it is an enriching way of nurturing our clients' brains, and it is also an accessible tool for the parents to connect with their kid. As adults, oftentimes they struggle playing. Somehow, infant massage, it is an in-between, like an open door to a closer, playful, spontaneous way to be with your kid." Thanks, Carmen. Okay, so number 2, pain and stress relief. And how many times have we heard our parents on our caseload say, "My child is so fussy. He cries with every diaper change, feeding, or taking a bath." In fact, researchers working with neonates developed a framework that addressed what they believed is of the utmost importance during infancy, including addressing pain and stress management. Okay, this framework is also known as the 5 core measures. They include protected sleep, pain and stress management, ADLs, a healing environment, and family-centered care. In the early intervention coaching world, you may have heard the phrase ease of positive participation. So simply put, how can we help our little ones engage in their every activities with as little stress as possible? In walks infant massage. So many of our littles hold their pain and stress in their bellies, right? So let me ask you a question. Do you ever experience a stomach ache when you're under stress? Okay. Is it difficult for you to focus on much else when your stomach is in knots? Well, of course it is. Ever have a parent tell you, "My baby is a hard burper," or "My child has to take Miralax on the daily to have a poopy diaper," right? So again, so many of our littles hold their pain and stress in their bellies. There are specific abdominal strokes to aid in what we call gastric motility, helping to promote that stress relief. Okay, so I wanted to share a quick story. So many of us wonder about the children on our caseloads, even long after they have discharged. We ask ourselves, did I make an impact? Does that child even remember me? Well, I was sitting in my hotel room getting ready for teaching in West Virginia when I got a surprise Facebook message. Karina wrote, "Hi, you may not know me, but I was one of your patients in North Carolina when I was about 5 years old. You changed my life for the better with occupational therapy. My mom always talks about how grateful she is for you and how you helped me. I am beyond grateful for you and your help. Thank you so much." Ooh, that gives me goosebumps to read. So I want you to notice 2 things from this story. Okay, so number 1, the child was 5 years old. Okay, and number 2, the treatment made a lasting impact. Okay, so how does this support your therapy goals? Okay, think about your littles with torticollis, cleft palate repair, or toddlers who are toe walking or have autism. Okay, implementing a touch routine with specific massage strokes will raise what we call the pain threshold, helping you and the child have a more positive experience when it comes to stretching, eating, or whatever other therapeutic activity that you are trying to work on. Jessica, a physical therapist in Maryland, wrote, "Infant massage has been a great addition to my pediatric therapy goals and have already used it with many of the infants on my caseload. The gas and colic routine has been particularly useful with my caseload, and these families are very thankful." Thanks, Jess. And guess what? If we've lowered their pain and stress and promoted that ease of positive participation, then we've just increased exponentially the odds of carryover. Boom, goal met, right? Okay, so moving on, let's look at number 3, rest and relaxation. How many times have we heard our parents say, "My baby just does not want to sleep through the night," or "My child takes forever to fall asleep"? And we all know if the child is not sleeping, then the parents are not sleeping. Everyone is wired and just running on fumes. No fun. Okay, so you remember those core measures that I mentioned earlier? Well, researchers have determined that the core measure of protected sleep is the most important core measure. This is because of all the repair our bodies are going through, and our brain is trying to process and store all the information it received throughout the day. Okay, so let's think about it. How well do you function on little sleep? Not well, right? Maybe we've been under so much stress that our cortisol levels are through the roof and we can't seem to unwind, or even worse, we wake up in the middle of the night. Same thing for our little ones and their families. So infant massage has proven to provide autonomic stability, heart rate, respiratory rate, and blood pressure stabilizing. With these internal systems stabilized, the child can now transition between activities, including transitioning to sleep. A huge win-win for the entire family. Okay, so how does this support your therapy goals? When the infant or child is able to access more forebrain function, then you see processing go up, reasoning goes up, motor skill development improves, growth goes up, and so much more. Plus, if the child is sleeping, then the parents are sleeping and functioning much better as well. A win-win all around. Megan, an early intervention provider in Maryland, wrote, "I honestly have to say that infant massage is one of, if not my most favorite part of my job." Thanks, Megan. All right, so bonding check, pain and stress management check, rest and relaxation check. Now, last but not least is stimulation. Okay, so did you know that touch is the most primitive of all sensory systems? It is the first to develop starting around 8 weeks gestation. So in theory, it should be the most developed at birth. Unfortunately, this is not true for a lot of the littles on our caseload. Whether you see primarily infants or toddlers or older children, look back in their medical record and see if they were born premature. If so, a break in the sequential order of sensory development did occur. Okay, so what does this mean? Well, chances are that the child's first experience with touch was negative due to life-saving measures. On top of that, the infant sensory systems are now competing, okay, over top of each other. What infant massage can do is go back and repair that break in the touch development. We can stimulate that sensory system, and in doing so, we'll help promote the positive development of other sensory systems, such as sound, smell, and sight. Think of it as building that good base of support. Okay, so how does addressing stimulation support your pediatric therapy goals? Many of our children ride that failure to thrive line, right? Or they're low on that growth scale. Infant massage will help to lower cortisol levels. Okay, so it lowers the cortisol levels. It promotes rest and relaxation, so the child's body will be stimulated to grow and develop. Using infant massage aids in tone normalization, brain development, and growth. It's amazing. Virginia, a speech therapist in Kentucky, wrote, "Infant massage provides sensory stimulation that aids in awareness of oral structures needed for pre-feeding and feeding readiness. This has been very helpful when working with kiddos that are struggling to maintain nutrition orally due to decreased awareness of the bottle at their lips or resting in their oral cavity. Thanks, Jen. Okay, so the good news is there is an all-in-one solution. The Certified Infant Massage Coach course is just 2 days of intensive learning of all the massage strokes, as well as how to implement them with various diagnoses and age groups. Okay, so I have done the legwork so you don't have to. The course is only offered to pediatric healthcare professionals. So yes, okay, we're going to cover what this looks like, using it for the child that makes you feel like you are at a run, or the infant that seems to cry and fuss with everything. Okay. I do want you to know course enrollment is also limited. When I first took my infant massage class, okay, back in 2004, the room was jam-packed. I was determined to create a course that is not only just for pediatric healthcare professionals, but also has the ability to be tailored to best meet your needs. So what does this mean? This means, okay, we will go over very specific infants and children on your caseloads. I'll help you problem solve where to begin, how to implement, how to document, what type of goals to write. I tell all my students that my goal as your trainer is to make sure that you can leave the course confident using your new skill and using it immediately.